I go to reception when the patient arrives and I meet and greet them and bring them up to the multidisciplinary team and help them to relax, I suppose, on the way up, just to settle them.
Part of my role is to support the multidisciplinary team and to help organise and schedule the patients both in our Castlebar base and our outreach hubs across Mayo.
As the first community connector in the post nationally, my role is to connect older people back in with the community organisations and services to increase their social support, health and well-being. Together with the older person, we do a well-being plan and that empowers them to take control of their well-being.
I think it's a terrific place. You come here, you're seen straight away. And the staff are so lovely, so friendly.
I assess older persons with complex healthcare needs, such as recurrent falls, frailty, dementia, and polypharmacy. And as a team, we deliver a patient-centered care plan with a multidisciplinary approach and under the supervision of the consultant geriatrician.
I commence the comprehensive geriatric assessment. I'm able to perform a full episode of care from admission to discharge, including assessment, diagnosis, treatment and review. I usually see the older person in their own home and bring follow-up into the local primary care centre. I identify issues for the older person and try to perform interventions to address these. I present the older person to the consultant geriatrician and refer on to the relevant multidisciplinary team members. I am a direct point of contact for the older person and their family.
I assess the client's mobility and overall function. I look at their strength, balance and coordination amongst other things. So together with the older person, we set physiotherapy treatment goals, and along with the physiotherapy assistant and wider multidisciplinary team, we instigate an action plan and programme in order to meet these goals.
It was extraordinary. The staff were wonderful. I was delighted with it. You're treated here like a person, not like a number.
We help the older people that we work with to overcome or work around any problems they might be experiencing in their daily life by looking at how their health condition affects them.
We help older people to find practical solutions to everyday challenges that they have. For example, physical interventions like helping them to get in and out of the bed or hanging clothes on the line.
We also explore how to make the most of your memory and the concentration if that's something the older person is worried about.
What matters to the older person, their hopes and wishes, is our focus.
The role of the dietitian was to guide and support the older person in their dietary choices with the aim of helping them to improve their nutritional status. This involves carrying out a thorough nutritional assessment. So from this, I can calculate the person's individual dietary requirements, and then I develop a tailored care plan to suit their specific healthcare needs. And once this care plan has been agreed with the person, it's reviewed at intervals to make sure that it continues to meet their healthcare needs ongoing.
I carry out geriatric comprehensive assessment with the patient. I work very closely with the advanced nurse practitioner and the consultant geriatrician to identify issues from the assessment and to develop and implement a plan of care. I monitor and evaluate the plan of care and make adjustments accordingly in consultation with the team. I also coordinate investigations, treatment therapies, patient follow-ups and referrals. And I work very closely with the patient and the family to provide support, education, self-management strategies and information if required.
I have to carry out a social assessment on the patient. I usually meet with the patient and sometimes a family member, and we look at things like home environment, their formal and informal supports and their health and social care needs. From there, I would usually refer people to community supports and services. A big part of my job would be to help people with future care planning and also to help carers who are experiencing carer burnout.